Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. It is a busy day in Providence and across Rhode Island. The coronavirus is exploding across the state. At 1 o'clock today, GoLocal will carry Governor Gina Raimondo's press weekly update, and I would expect she'll have some big news relative to the state's effort to combat the virus. Right now, we're going to go to Dr. Michael Fine. He's the former Rhode Island Director of Health. Yesterday, he outlined, and it's printed in GoLocal this morning, strategies to be able to stop the level of increase we're seeing. Dr. Fine, thanks so much for joining us.
Thanks, Josh. Remember, those strategies were to try to get us to 2 cases per 100,000, 2 new cases per 100,000 per day. You know, we're now at about 93 new cases per 100,000 per day.
Yeah, we're at 936 new cases today, as reported by the Rhode Island Department of Health. 1 week and 1 day ago, we were at 466 new cases. So in approximately a week, we have doubled the number of new cases, and things are just continuing to explode. Does it get faster? Does the doubling quicken? And does it stop doubling and actually multiply? I mean, could we be in 3 weeks at 4,000 new cases in a day?
Yeah, the answer to any could is always yes.
I'm probing beyond the could. What is your element of analysis as to where we are and how quickly this will explode?
I think unless we do something different, the rate of rise will increase. Because remember, now we have 936 people who can spread it, each to a number of others. And each of those then can spread it to a number of others. So it begins to move, I think, much faster now, unless we do something different.
And as always, we haven't talked about this in a week or so. The CDC says, listen, when you're doing testing, it's probably only representative of 1 in 5 actual cases or 1 in 10 actual cases of those who are infected. So at 936, we could have somewhere around 5,000 to 10,000 people who are actually infected with the virus right now in Rhode Island.
Actually newly infected. Remember, each of those people who become infected are likely to be infectious for a number of days, 5 to 10, declining over time. So, if we're talking about 10,000 newly infected, then my guess is we're talking about 50,000 walking around with the virus and spreading it.
Dr. Fine, maybe the good news was we conducted 19,000 tests. We know that on average, about 4,000 of those tests, 4,000 to 5,000, took place in the colleges and universities. Those were asymptomatic tests. The colleges and universities right now are producing very little infection, on average around 20 new cases a day. And then we know that some portion of that 19,000 reduced the colleges. We're talking 15,000. Were asymptomatic tests, but we don't know. The Department of Health has been unable to break out those numbers with any timeliness. So we know, let's call it 14,000 tests were conducted yesterday in Rhode Island, netted out 900 on 14,000. We can't do much more testing than about 19,000 with the existing infrastructure. As I understand it, just the ability to get people through lines and get them scheduled, we've got a backlog. The other thing we're hearing consistently from the hospitals is that long waits in emergency rooms, long waits in scheduling visits. They're trying to bifurcate and get the potential coronavirus infections away from the other emergency room patients. The hospitals are starting to stress now, and where do they go for relief?
I assume they have always been exceptional at putting together contingency planning. And begin to move to more of a, sort of COVID-focused treatment process. They're going to need lots of their to sort of pull in all their part-timers and so forth, to be able to staff what's coming well. Remember, I expect our number of people in the hospital to double over the next 2 to 3 weeks. So, they're going to be really, really, really busy.
Yeah, I mean, listen, you've been right spot on the numbers. On November 4th, we were looking at, November 4th, we were at 169. I think you said the next week we'd be between 210 and 220. We were at 232 today. You actually underestimated a little bit. Our hospitals, if this rate of growth continues, hit a saturation point maybe as quickly as in the next 2 weeks.
Well, I don't think we'll saturate in 2 weeks. People will be stressed in 2 weeks. I'm more worried about 4 to 6 or 8 weeks, because if this continues to move unchecked, as it is now, then I think we will hit, saturation and exhaustion, and we'll start to see healthcare workers infected because they get tired. The work of staying COVID free yourself, the putting on and taking off of personal protective equipment, and the care you have to devote to not getting infected is huge. As people get tired, that starts to break down, and then we'll start seeing healthcare workers getting infected. I expect we are now seeing, I've seen some reports of police and fire and EMS people getting infected. So I'm expecting we'll start to see some stresses in those systems because of the number of people they have being infected and who are out on quarantine or on isolation for 10 days, and their coworkers who go out on quarantine for 14 days. One of the troubling pieces of data that came out yesterday was a publication in the New England Journal of Medicine looking at military recruits, 2 different groups of military folks. And it makes it look like it is possible that the time we're using for quarantine of 14 days may be too short, that the incubation period may turn out to be longer, something I've suspected for a long time. But this is the first published indication that if quarantine is going to be effective, and I'm not convinced it's been effective at all, but if quarantine is going to be effective, it may be 3 weeks of quarantine, and then what a mess we'll have in that environment.
Yeah, I mean, listen, we're seeing it fraying. I think GoLocal broke that the Providence police had an outbreak. I think we broke that about a week ago. It was reported at 10. There were rumors. It then grew to 20 cases, and Providence police officers out on leave at a force that's functionally undermanned. In the best of circumstances, this creates a lot of stress and a lot of overtime. It has a financial impact because other officers are coming back on overtime costs, not on standard costs. So there's unintended consequences and a real economic cost to a lot of systems when we don't control this virus. I will talk a little bit about, I talked to one significant restaurant group owner last night, and he said, listen, we just can't take the brunt of this again. He said, even if, as you had outlined in your strategies, one of them being let the state reimburse businesses that we close if we decide to close them. He said, listen, it doesn't work that way. We can't just close for 2 months. It has ramifications. We lose our staff. We can't get them back. They will leave. They become free agents the minute you close down. It has an impact across the board. We are really up against it in a lot of different ways, and we've somewhat lost our will to fight as hard as we did in the spring.
Yeah, I think that's right. I think we don't have public consensus about what to do. I think there are plenty of people who think, let's just ride it out and we'll deal with it as it comes. And, who don't want to or can't, change what they're doing or reduce their time. I think this is where leadership is going to be really important in helping people do what we need to do, if that is what we choose to do. But I'm not convinced that small measures are going to make any difference right now. I think if we're going to take this on, we're going to need big measures. The work, it seems to me, is to build the public consensus around taking it on, and put time and energy into that so we can make a decision together about how we're going to handle this.
Dr. Fine, the governor comes on in about 30 minutes. It's 20 of. She's always 10 minutes late, so we'll say 1:10. You outlined 7 strategies today. Do you think she comes close to any of those strategies? They're pretty dynamic. They are things, in most cases, we have not done before. A real functional isolation strategy, some of your other suggestions on transforming the testing strategy that we've adopted. Do you think she comes close on any of those things?
I think it's going to be really hard for her to do that, lacking the kind of public consensus I'm talking about. I think the challenge for anybody in government now is to go forward in a way that has support of the population. And so in many ways, I think the challenge at this moment is building that support, helping people understand where we are, helping people understand we're not where we want to be or even close to it, and beginning to think about, sort of moving into a consciousness of the challenge that lays in front of us, and then helping people develop the hope they need to work together and sacrifice together, because that's what it's going to take.
Dr. Michael Fine, I want to thank you so much. If you have not read his 7 strategies for how to stop the level of spread and reverse it and get it down to a manageable, consistent level, please do so. It's on GoLocal. 1 o'clock, Governor Raimondo. 2 o'clock, the chair of the Political Science Department at the University of Virginia, Jennifer Lawless, will be talking about the Biden administration and what we look for in the development of the president-elect's cabinet and strategies on the coronavirus. So a lot of news still to come this afternoon on GoLocal. Everyone, save a job, save a business, wear your mask. Thank you.
Thanks, Josh.